Welcome to our ventilation and respiratory terminology lesson. You can find this on pages 122 to 123 of your Nurse Workbook 2.0, or you can print the pages below me and follow along, or come back and fill it out to retest your knowledge. The purpose of this video is to provide you with real-world nursing education beyond the Nurse Workbook 2.0. And if you can understand the fundamentals in today's lesson, you're going to be much further ahead than a lot of people in the nursing world, because a lot of these 5 terms and fundamentals are only taught in our critical care settings, but they are pretty basic and easy to understand if we take the time to break them down. So when our patients come in with any kind of respiratory distress or difficulty breathing, we want to make sure that we can effectively oxygenate our patients and have good lung compliance. There's a lot more to breathing than just putting oxygen in and putting a mask on them. So let's get started with these 5 terms and what effective lung compliance and oxygenation really means. We're going to define the 5 absolutes to ventilation. And our first one is our tidal volume. So we want to think of this like a balloon. This is the amount of air by milliliters that you're giving a person during each breath. So think of this balloon, and that bag valve mask is like a balloon that we're going to be squeezing into our patients. So this is about 500 to 600 milliliters on an adult, or 7 to 8 milliliters per kilo that we aim to give. So tidal volume is that lovely balloon that we squeeze into them. So how many milliliters are inside this balloon that we're going to be pushing in? And next we have our flow rate. So this is the rate that we're going to push volume into our lungs. We can give this volume quickly, or we can give this volume slowly. So when you hook your patient up to oxygen and you put them on 2 or 3 liters, or you hear that a patient is on 2 or 3 liters, this is your flow. So essentially this is saying they're on 2 liters per minute. And this is not to be confused with our respiratory rate. So flow is liters per minute, as our respiratory rate, or our next term, is the number of breaths the patient takes per minute. So our total respiratory rate includes spontaneous breathing, and if they're on a ventilator, this includes our ventilator breaths as well. So on some settings, our patients can breathe over a ventilator rate. And our normal range we aim for is 12 to 20 respirations per minute. And our next term is our oxygen, or our FiO2. So this is actually our oxygen concentration. Our FiO2 is an abbreviation for fraction of inspired oxygen. So this is the concentration of oxygen that you're putting into the inspired air. Our room air is 21% oxygen concentration, but with our equipment, we can add 100% pure oxygen. For example, our patients with pneumonia could have that fluid or that pus inside the alveoli. So by using our FiO2, we can increase the oxygen because pneumonia is going to impair that carbon dioxide and oxygen gas exchange. So by increasing it, we're actually helping those lungs so they don't have to work as hard because of this pneumonia present. And lastly, we have our pressure, or our PEEP. And PEEP stands for positive end expiratory pressure. So this is how much pressure is kept in the lungs after the end of expiration. So this is what keeps our alveoli open and prevents it from collapsing. So our PEEP is going to be that pressure that we're pushing in to that beautiful little sac, our alveoli. So in certain things like our ARDS, our acute respiratory distress syndrome, we can actually have our alveoli collapsing. And by pushing in that positive pressure, we can keep it open so that way that gas exchange can occur. But like anything, there can always be too much of something. So if we increase this PEEP too much, then we can actually create something called barotrauma. And barotrauma is actually lung damage from way too much pressure coming into these alveoli. And in this next section, you can go ahead and pause the video and fill out these terms yourself, or you can go ahead and let the video play so you can see what these definitions are. The following terms we're going to go into so much more in depth in the following lessons of this respiratory module. And this concludes our ventilation and respiratory terminology lesson. I'll see you in the next one.